morning. I'm really excited to be here, especially on the same panel as Dr. Glassman. I was one of his students actually in dental school, so it's really a privilege to be here. I learned a lot, so that's why I'm in public health. It's really exciting, and it's one of the many things I've always wanted to do, so I'm really excited to be here. I'm only one of the many screening dentists at the Healthier Kids Foundation. The Healthier Kids Foundation is a family-forward health agency. Every day, we work with families to identify health issues before they even begin. Forgot I had that handy. This is cool. We believe preventative care at an early age makes things fair. That's why we started DentalFirst. Okay, some of our core values include finding the right path for each family. We want to level the playing field by allowing access to care for every child. We want to be proactive in prevention and education. We want to stand up for these children that are in need. When kids have healthy teeth, they can avoid serious dental issues. As a screening dentist, we screen for undetected decay, and we have follow-up case managers to follow up to make sure that these children are receiving treatment. We have a total of 6 screeners, 15 contracted dentists, and we go to 150 plus sites per year. We see 20,000 children per year. That's amazing. It's a lot of teeth. Okay, so how do we prioritize where we go first? Well, we look at where 50% of the kids are eligible for the free and reduced lunch programs, and those are the sites that we begin. Okay, so in 2018 to 2019, 32% of the children screened received a referral, and those children had severe dental decay. We can see that there's been an increase in urgency and emergency referrals, and it's increasing every year. This is from ages 0 to 18. We estimate that about 2,000 children in Santa Clara County go to school each day with pain due to dental decay. A lot of kids. So I'm going to be a little graphic here, but I want you to see, as a public health dentist, these are the kind of children and kind of cases that I see on a daily basis. This is, I want to explain what we see or think about as urgent versus emergency referrals. So this one on the right side, this child has decay obviously on the front teeth. Although the child has decay, the child is not in pain. The child eats okay, everything is fine, but has a decay on the front teeth. The other is an emergency referral. That child is in pain. It has an abscess on the front. This abscess can continue and cause pain. You can get swelling of the face. They can be up all night crying. The parent is calling me, what do I do? They have to go sometimes to the emergency room, receive IV antibiotics because if the swelling gets too much, and sometimes it can even close the eye from swelling of the face. So this is emergency referral care that needs immediate care. So I just want to point out the difference on why we need to get these kids in. But the rate is increasing. So this is real. I just want to bring this up. Super important. Okay, so as a screening dentist, I want you to take out in your little swag bag, I guess that's what they call it now. You have a form, and it is actually a screening form. So I kind of want to go over and tell you exactly how we do this as a screening dentist. Okay? And another thing you have in your bag is these little tiny lollipops. Does anyone know what these are? Okay, this lollipop is sugar-free. This is xylitol. This is a xylitol lollipop. This is a really cool thing. We're finding that xylitol helps reduce dental decay. It helps increase saliva production, which then doesn't allow the plaque to stick to your teeth. Without plaque sticking to your teeth, then we have less decay, okay? This is a great alternative for other kids to have a lollipop that's sugar-free, still tastes good. You can taste it. You have one in your bag, so I want you guys to taste it. It's a really cool thing.
It's great if everybody opens it, or if you don't want it now, hold it up and get a picture of everybody.
Yeah, it's really cool. You can get them online, Amazon. Really cool. So another great thing that we find is that mothers who have xylitol, they have less production of the bacteria, then therefore they're not transferring this bacteria to their children. Okay, and this helps reduce that bacteria that's cavity causing. And so this is super important, but this is a great alternative that children can enjoy, something that's safe to use. Okay, so I do want to go over a little bit about our screening form so you guys can take a look and follow along. So basically when I'm at a school site, I have a screening assistant. I dictate to them exactly what I see. I have the patient, they're really little. We have in the back of their classroom, we kind of sit there. I have like a headlamp, and I basically look in and dictate what I see. So if I see decay, I tell her the teeth numbers. Usually on kids, they have primary teeth, they're in letters, and adult teeth are in numbers. So I dictate to them which teeth have decay, and then we can mark whether they're urgent or emergency care that's needed. So I'm looking for urgent care. I see a lot of cavities. They could progress to emergency, right, if we don't treat them, and then now you have an emergency situation because those caries are just sitting there. So we definitely need to treat those. Another category I can mark is, some kids, if they don't have anything going on, they still need preventative care. That means we need cleanings, we need fluoride, we need sealants, like Dr. Glassman said. And in some of these cases where we do have urgent care, if the child's afraid, these dentists can be using the SDF, the silver diamine fluoride, in those situations where, they're too immature, we can't treat them. Those are some alternatives that, we can be able to treat these children. Okay, I'm really getting into this. Okay, so I just love this. Okay, so case management, we have 10 case managers. They're bilingual and bicultural to ensure the children is enrolled in health insurance programs. Okay, sometimes these families, they're not sure, they're kind of afraid to give information, they don't really understand how to fill out the application, and these case managers are amazing. They go above and beyond, and they help these families get enrolled in these programs. And then after that, not only that, they continue the follow-up until the treatment is completely done. In one of the cases when I saw a screening, I noticed something on a child, and it was a large lump. Obviously, it didn't need to be there. It was, it shouldn't be there. So I thought, okay, we need to get this checked. So I called, and one of the case managers was, Dr. Ray, I got it. I emailed again, don't worry, I sent them to get a biopsy so we can find out what exactly it is. But, I was really worried that somehow that child was going to get lost. No, that child did not get lost and fall through the cracks or anything like that. That case manager took that patient and made sure they got care. And, with that, you find a biopsy that was benign and everything was okay. But you never know. You can find something that is an underlying disease, and we really need these kids to be treated. But the case manager followed through to be sure that this child got the treatment. So that's super important. Today, 67,000 children have been screened since 2014. That's a whole lot of teeth. okay? 30% identify with some type of dental issue. 56% of those referred were actually, they actually visited a dentist, which is awesome, okay? Okay, so with screenings, with all these forms, we can collect a lot of data too to help us think about what we can use this data for. But collecting the data, we get info from the child. We can get the results. How many kids had needed preventative care, emergency care, urgent care, so we can get all those numbers, which is super important. Parent contact, we get parent contact information. We can find out where these kids live and find out demographically, okay, we have more decay in this area, maybe we should focus in this area a little bit more. Also follow-up, we can, with our case managers, we're following up, hey, is insurance status, do they still have insurance, or do they need coverage? You know, are they falling, you know, off the edge here, and we need to help them out and get them coverage again? So that's really important. We have case history, which we can collect the data. Are these patients going to the dentist every 6 months? You know, and that's part of the data. That's super important. And then upcoming appointments, are they attending their appointments? Are they showing up and getting the treatment done? After the case manager, you know, links them to a provider, we want to make sure, hey, are they showing up to the appointment? Because maybe the parent, you know, couldn't make it and they keep canceling. We need to find that out. Okay, and case outcomes are the treatment that's being rendered, is it completed? Do we have success in completing all the treatment? Okay, so that's really valuable information that we can get from this. So with the program evaluation, you know, we find that it builds awareness for the families. It helps assisting families with insurance services that they are entitled to and how to access them. And it helps them to see how dental care impacts their child's education's outcome. With children that are in pain, they can't sit there and focus. You know, they're constantly moving around. The teacher doesn't understand why they're acting out or paying attention. And a lot of times when we go and do the screenings and we send the note back, the parent says, I had no idea that my kid had a cavity back there. Or they're getting 6-year molars back there and, you know, they're bleeding and I had no idea. Okay, so it really affects how they learn in school, and you know that's huge. Also, the importance of health habits for all kids, that they eat healthier. They need to eat breakfast, and if they need, they're not getting food at home with these lunch programs, they are, so they can be able to concentrate and also eat healthy meals to help reduce, you know, like diabetes. That's super important. Okay, so we sent out a survey to find out how we're doing, and to the parents to find out how long since it was their child's last dental visit, and it was great. 93% actually visited the dentist less than 12 months. So that's a huge deal. That means they're really, you know, they're going back, they're visiting the dentist. The next survey, we wanted to ask the reason for your dental visit. And most patients were going back, 84%, for their regular checkup and exam and cleaning. That's preventative care. That's huge. Once these kids are getting connected to a dental home, they're staying there. They're going back over and over again. That means they're going every 6 months. And that reduces their dental issues because they're getting preventative care. They're getting cleanings, they're getting fluoride, they're getting sealants, they're getting education every time they go every 6 months, and understanding the importance of, okay, I gotta brush 2 times a day, I gotta brush for 2 minutes. And the children, if they go all the time, they're learning that. That prevents these emergencies, that prevents all those crazy abscess that I see all the time, that maybe one day I'll wake up and not see anymore. But that's, you know, it's hard to see that. But it's really great to know that, you know, these kids and these parents are really sticking with it. Okay, so when we asked parents whether there was a time during the past 12 months when their child needed dental care but could not get it, only 10% reported they could not access the services. 22 said insurances did not cover the recommended procedures. Sometimes that happens with some of the insurance and how you word it and so forth. They're very particular with coverage. 19% could not afford the costs. Another 19 were afraid or they don't like me. 19% were unable to take time off work, and 9% the dental office was not open at convenient times. Sometimes that happens with parents that work all the time. For pediatric clinics, there's not really nighttime appointments or Saturday appointments. So there's very few offices that offer evening or weekend appointments, and then it's harder for the parents to take the children. So that's why with Dr. Glassman, having these school-based clinics, that really makes an impact on that. That is just, if that makes it so convenient for the parents so they don't have to miss work, the care can be in their schools. 9% didn't think anything was wrong or the issue would go away. 3%, the dental office was too far away. Okay, the impact, I think this is a huge impact that, with the Healthier Kids Foundation, they're establishing these ongoing connections with these providers. They're actually keeping these kids together, and they have a dental home, and we can see by the statistics from the data that we collected that they're returning to the dentist, and they're going every 6 months. So I think that that's huge, and that's a huge impact. Once the parents are aware of their child's dental needs, we are able to connect their care to continue this preventative process. Even after we let them go and we're done with our job, they're continuing the care, and that's huge. That's a huge impact on making this continue, and having preventative care is reducing the amount of, these dental issues that are really severe for these children. Okay, so I really want to talk to you about 2 kids that are very special. I'm going to read a testimony sent by one of the moms, and I think it's important, so I do want to read it to you. So on the right side, we have Gabriella, and I want to read what her mom sent. I have been worrying about Gabriella's dental hygiene for quite some time. I knew that she needed a lot of work to be done, but her dentist recommended that she receive the treatment with IV sedation. That means with the child asleep, which would cost me about $10,000. That's a lot of money that my husband and I don't have. And Gabriella's insurance does not cover IV sedation. For over a year, I have been contacting several dental offices to shop and compare the cost of sedation. Every dental office I called either did not offer IV sedation or would charge me an arm and a leg. Thanks to the Healthier Kids Foundation, I was able to find an office that could help us and that I could afford. Gabrielle has finally received the treatment that she's been needing. She has received 4 fillings, 1 crown, baby molar extraction where she had an infection, and 1 space maintainer. She is so proud of her silver teeth that she opens her mouth wide and goes, ah, to show off her silver teeth to all of her teachers and friends. She walks around with the biggest smile on her face. And I can finally check the one thing off my list of things to do. Thank you, Healthier Kids Foundation, Lydia. Pretty neat. That's awesome. And this little boy, his sibling wrote in, and this is kind of a little short, but it's really touching. I am so thankful for the support of my case manager. My little brother has had a bad experience with his former dentist. He was scared to go back. My case manager empowered me and my brother to get his dental needs taken care of, and she recommended a kid-friendly clinic. She also assisted us with our insurance. I received a letter from the social service agency about our plan. I didn't understand it. She helped me understand the benefits I could utilize for my big brother. and that's dung, sibling and caregiver. So the older brother was helping his little brother. Yeah. So I have, the one last thing I like to say is I think everyone in the room here probably feels the same way, that I think we truly believe that access to care is a right, is a human right. And I truly believe that. So thank you for your time.
So if we can get some questions, I also do want to mention that the anesthesia was First 5 funded. So I think that's important to know. And Sunny looked at our data lately, and we're adding to the referral form when it's an absolute emergency, 24-hour. When she checked 2 weeks ago, we had 93 of those cases, which means the dentist said this child needs to get in the next day. So, Dr. Glassman, we would love to get to prevention. We've been spending most of our time on intervention these days, but it would be great to get to the prevention part. So we have some questions. To what do you attribute increase in urgent emergency cases? That's a good question. How does DentalFirst work with Santa Cruz County?
Dentist in Santa Cruz County.
Oh, who is advocating for parity in coverage? Dental equals to some as medical. Oh, making sure dental is similar to medical, don't you think? Without the caps on dental versus medical. On the first one, we're not sure what we can attribute the increases, except I think we have figured out where the greatest need is, and so we tend to just focus in those areas, and we do the mandatory grades, which are TKK, 2nd, 5th, 8th, and 10th. So we're not getting every grade each year. So I think that's part of it, is my guess.
And it's hard to also monitor, because if the children move, and we also get an influx of other children in that area, and they're low income, and then we haven't screened them yet. So, that's other stuff we really need to investigate on why this continues to increase with urgent and emergency care, I think. So with the data that we're collecting, we're just gonna have to learn from it and try to focus and find out more about that and how to alleviate that problem.
And I'll add, one of the things we're most excited about is Dr. Dewan convinced us of the importance of state IDs. So children in California all get a state ID when they enter school, and Dr. Dewan's trying to move it down into preschool. But it's exciting to think that children will have a unique number, all children, and the thought is even you could take that unique number to medical. Because if you're using medical in more than one place, you don't get a unique number. So if my son who needs Stanford and then goes back to Valley Med, he's getting 2 different numbers, but he only has one state ID number. So it's pretty exciting to see how we could go from the school districts through the health up to the health links in the Valley Medical Center and back and forth.
Okay, so this one was, how does DentalFirst work with dentists in Santa Cruz County? I actually live in Santa Cruz and I volunteered with dentists once before. I'm not sure how they coordinate. I don't really know about if they work together. I think they should and network together. There's a lot to be done in Santa Cruz County. So right now I do my part. I work with Salud and advocate for care for children. I also teach at Cabrillo, and I try to get the dental hygienists to go out into public health settings and be able to help the kids in their community. So we're doing a lot of work with trying to network these other agencies. So yes, I do hope that they network with Dentist Clinic, because that's also a nonprofit clinic that's, really, they do great work there. Okay.
Well, and we have, with the help of Welsh Allen, moved our vision program to Santa Cruz. But they felt they had their own programs around dental. So maybe we need to push harder. Advocating for parity coverage, dental versus medical. That's a question for Dr. Glassman, I think. We'll ask him that one during the break.
What is the risk or benefit of just making dental varnish a simple prescription that parents apply at home? Well, I think that I can't say, when I even ask them to put a smear on the toothbrush, sometimes they might gob it on there. So I can't really trust the parent if they're going to really follow the directions correctly at home. Sometimes they think, a lot is better. So, even with just over-the-counter meds in medication, I gave them cough medicine, but I gave them a little bit more. Okay, well, it says not to. It says to give them 5 ml, and you didn't have to give them like 15, So I think that there can be risk, but there's also over-the-counter fluoride rinses that are easy to do. But also, you still have to monitor the children. They still need help brushing up until 10 years old. So they really need to be monitored. And a lot of parents, they think, okay, well, geez, they're already 10. They should just be doing it by themselves. Why do I have to keep checking? But a lot of times I find that the kids come back in and they have lots of plaque. They're only getting the front teeth and leaving all the back teeth. So their parents really need to be part of that, and really, so I think that would be tough for them to do at home, and really rely that they're applying it correctly, because even some of the over-counter, rinses, they use water afterwards. So that kind of, dilutes it and kind of defeats the whole purpose if they're not even using over-the-counter correctly. So I have a hard time thinking that they might, that they would use the prescription correctly at home. But when we apply it in the dental office, I can, make sure that it's applied correctly, and then also review oral hygiene instructions as well. So I get another chance to talk to him again. So I think it's better.
And I will add, Dietrich, why don't you stand up? Dietrich is a principal in Alum Rock, and I'm pointing him out because he's agreed to work with us on some preventive work in his school. And I think if I call him out, he's got to get that done. Right? Okay. Thank you, Jessica. Thank you, Dr. Ray.